Hello, Dr. Lavanya. Good afternoon. Thank you for joining.
Hi, good afternoon.
This is Pinkasha from Pakistan.
Hi, how are you?
Very
How are
well.
you, Prasha?
Good afternoon.
So,
We, yes,
yeah, go ahead, Pinkash.
we'll wait for another 5 minutes for
Yes, yes, definitely.
join in. Yes.
Yes, yes, yeah. We'll
You
wait
can
for
try
more people to
your
come.
screen share in the meanwhile. I
Yes, yes, we'll see if everything is okay. I'll try to do the screen share and we'll test it.
sure. I can see your screen, Dr. Lavanya.
Okay, okay. Then I'll stop for a minute until we start, or shall I leave it like this?
You can leave it like this. When we start, I'll just quickly introduce you and then we can start.
Sure, sure.
Hi, everybody. This is Pinkasha from Passphere. Today is also World Health Day, and we thought why not have a session on how to build immunity and how to find, feel, get more aware about the non-communicable diseases like diabetes and heart diseases, and to educate us about non-communicable diseases and everything we need to know about boosting and building our immunity. We have with us Dr. Lavanya. She's the Chief Medical Officer from Ekin Care. Dr. Lavanya, thank you so much for joining and taking out the time today. And we thought no better day than today to learn more about health and the most, uh, like a biggest health crisis of our country right now, non-communicable diseases, and how do we build awareness and immunity against them. So welcome, doctor, and please take us through what are we going to learn today.
Thank you, Kasha. We'll start the session right away.
Sure.
So, I mean, you guys chose a very good topic because while we are aware that non-communicable diseases have been causing disease burden on the country, not just in India, globally. Um, Lately we haven't been talking much about it. There was COVID, there was a lot of focus on prevention of infections, hand hygiene, social distancing, and all those things. Somewhere in the midst of it, I think awareness sessions on non communicable diseases have gone down. That's what at least I have noticed, because we used to do a lot before COVID. After COVID, the number of requests have gone down. But the fact is that at the end of the day, still non communicable diseases are the majority of the conditions that are causing disease burden across the globe. And World Health Organization reports at least 40 million people being taken by non communicable diseases, and this is almost 70% of the deaths globally. That's a lot. And every year 17 million people die, and majority of them die before the age of 70 years. Now today, if we see the average lifespan of men and women, it has been increasing ever since we got independence. It used to be 46, 47 years in 1947, and due to improvement in lot of facilities, which I will brief in a couple of minutes, the lifespan of people has increased. Now it was 66, 67 years for men and women, and it is increasing even more. It is crossing 70 now, and it is only going to increase some more. People are going to live longer. That means that any life lost before the age of 60 is going to be very sad. um, and today, though we say average age that people are dying is just a blanket statement before the age of 70 years, in practice we are seeing a lot of people coming with heart diseases in 40s and sometimes even 30s. um, and that is very young to be having a cardiovascular disease. Now moving on.
Dr. Lavanya, I
Yes.
see a part of your screen and not the like a present screen mode.
Okay, is it
Uh,
better now?
yeah, it is, but I think it's still not the slideshow
There
mode.
is a slideshow option, but sometimes the okay, let me try that. The slides jumble sometimes, but we will
Okay.
still try only if that is
Then
happening.
I think this is good. This is good.
Let's try. If that is happening, I'll go back. See, it's moving before I even move. Uh, I think it's there is a timer in this. Let's try anyway. Now, when we are talking about non communicable diseases, we are talking about mainly four groups. It's cardiovascular diseases. These cause the majority of deaths, 17 million out of 40 million. Cancers, 9 million. Respiratory diseases, which account for COPD and asthma. And diabetes, 1.6 million. When we talk about cardiovascular disease, in that hypertension is included, because hypertension is one of the causes for cardiovascular disease, and diabetes actually is a cause for cardiovascular disease. So it is represented two places. um, and earlier in 1960s, these non-communicable diseases are thought to be conditions of wealthy countries. But later, as years progressed, now at this point, the burden is more in developing countries rather than developed countries. Why? Because the awareness is going down. As food is readily available even in developing countries, the knowledge about dietary intake, the knowledge about physical exercise and all that is lacking. So because of these reasons, developing countries are falling prey to non-communicable diseases. Now, if we talk about 1940s, right? In fact, entire 20th century, the other causes for deaths used to be wars, famine, and infections. There used to be smallpox, which is completely eradicated now thanks to vaccination. No more wars now. And famine is also comparatively has affected less now because of food storage industry and readily available foods. Now, what caused this shift? What happened in science and globally in evolution that this shift has caused? So, the first and foremost is antibiotics. Now, whatever infections people are succumbing to, whether it is tuberculosis, whether it is flu, and malaria, um, a lot of conditions that people were giving in, and antibiotics were developed. Penicillin breakthrough invention was penicillin, and after penicillin many more antibiotics have been developed, and because of that lot of infections have cure now. Though some of the viral infections don't have cure, lot of bacterial infections have cure. So that decreased as the cause of death, and vaccines start, because of vaccination there was good prevention of lot of conditions in children and in adults. And obviously the water got better, the sanitation has improved, and food safety, there are certain standards being maintained now for food safety. And because of improved education, a lot of people know how they can prevent infections. They know about vaccination, they know about treatments, and the medical care has comparatively increased. More hospitals, more clinics, more specialities now. All this has led to decrease in infections and decrease in deficiencies. We used to have a lot of deficiencies in kids and in adults. Now we see less of those deficiencies. Now, when we talk about non communicable diseases, we call them lifestyle diseases in layman's lingo. So, while non communicable diseases is a medical term, we call them generally as lifestyle diseases. Now, we stopped walking because of improved transportation, and we are taking high calorie diet, no more home food of at least for few meals everyone is eating out. And alcohol intake has increased, at least in India it has increased a lot as per statistics. Smoking has increased. There was a decrease in smoking in men, but there is a slight increase in smoking in women. Still the numbers are high. And then with urbanization and everyone having full-time jobs, there is lot of stress and lot of lack of resources in terms of childcare support and all those things. All this stress and these conditions are leading to certain medical conditions, like for example hypertension has a cause as stress. And stress also leads to change in dietary habits, increased intake of calories, and this in turn leads to obesity, overweight, leading to PCOS in women, which again leads to infertility, which again causes marital stress, which again leads to lot of other conditions. So it's a vicious cycle. Um, Now, if we have to understand the cause of non-communicable diseases, we can't just say simply lifestyle, because there is also a genetic component, there is environmental component, and behavioral factors like lifestyle. When we say environmental factors, we'll take few examples like pollution. We know that asthma and some other reactive airway diseases are increasing in some cities, like Delhi and some other cities, because of pollution. That's an environmental factor. And Indians generally, they have a genetic predisposition for some conditions like diabetes, obesity, because genetically we require lesser calories. Our background is we are exposed to famine many times, and we don't take increase in calories, our body doesn't take it very well. So we have that genetic predisposition for certain conditions, like in Indians breast cancer is detected earlier. Similarly diabetes is detected earlier. While western people are having in their 50s, we are seeing these conditions in 40s or late 30s. Now, the sad thing is people of all age groups and regions are affected. It is not like earlier. these conditions were thought to be urban conditions. Now, even in villages, we see diabetes, hypertension, and all. And children are also exposed to the fast diets and lack of burning of calories, and we see obesity in them. We are seeing diabetes occurring earlier, and adolescent girls are experiencing PCOD more than before, a decade before. Now, um, because of this, um, all these conditions that I have listed have increased. Diabetes, we all know, hypertension as a non communicable disease, stroke and cardiovascular disease, hyperlipidemia, and COPD. COPD has smoking as a big cause, asthma, reactive airway disease, PCOD in women, and indirectly, all these lifestyle changes are also causing a lot of arthritis, sleep problems, snoring, obstructive sleep apnea because of increased fat around the neck. The airway is constricted, and there is a lot of snoring problems occurring, and a lot of people are having restless sleep, which in turn is causing cardiovascular disease. And people are having gut issues like acidity issues because of late night meals, or unhealthy meals, or street food. Lot of gut issues and irritable bowel syndrome secondary to stress and all those things. And we see complaints of body pains, muscle aches, conditions like fibromyalgia more often. These have some environmental factors and certain stress issues as a cause, as causes. Now, some other for psychological illnesses, anxiety, depression, and OCDs, these are also on the rise. But today we are not going to be focusing on that. NCD is actually a very vast topic. But today, in the limited time, what we'll try to understand is the basics. Where do we need to start to prevent these NCDs? Because diabetes itself is, it's vast. All these conditions, if we go into details of these, we need 1 hour
Dr.
to.
Lavanya, sorry
Yes.
to cut you. The slides are not moving.
Okay. Are you seeing the slide with the
I
list?
can, no, I can see the slide third, which is four groups account for 81% of all NCD.
Oh, okay, okay. So I have moved lot of. Okay. Let me share again because I've been moving slides and you're not seeing. Hold on 1 second. So, so we talked about the four groups. Then we talked about what caused deaths in pre-independence and immediate post-independence era. Then we talked about the inventions that made the shift from communicable to non-communicable diseases, namely antibiotics, vaccines, food safety, and improved knowledge about preventive practices. And then now you're able to see the slides moving, right, Pikasha?
Yes, doctor.
Okay. And then we talked about the changes that happened in the society that led to sedentary lifestyles and certain changes in our habits and lifestyle. We talked about tobacco and alcohol, and diet and sedentary lifestyle. Then we talked about a little bit more about causative factors of non-communicable diseases. And now we are here at the list, and we just covered the top few, the top 8 are the most common lifestyle conditions that we are seeing: diabetes, hypertension, stroke, hyperlipidemia, cardiovascular disease, COPD, asthma, and PCOD. But the ones in small are not to be ignored either, because these are also on the rise: sleep problems and snoring, obstructive sleep apnea, stress related issues, gut related issues really are on the rise. And we the new knowledge about gut biome and why and how gut biome is so important to have a healthy gut biome. and how it is affecting our overall health. More and more research is coming out. In the context, what we eat matters a lot. What we eat and how we eat. So we'll discuss that in coming slides. So here we are, and I was saying is that if we have to address each and every one of these conditions, they themselves are a uh, big topic. But today, we'll understand the root cause and what we can do at a basic level for prevention, detection, and managing these conditions. Though I'll be talking generally, I'll take examples of diabetes, hypertension, cardiovascular disease throughout my talk. That way, you can relate. It is not completely some generic, generic talk, because the preventive aspect, the lifestyle aspect, the screening and management aspect, all are having a lot of commonalities for these conditions. So we have to understand the broad principles, and then it is very fruitful in managing these conditions. Okay. Now, when we talk about the non-communicable diseases, how can we handle them? First, we need to start these practices before the disease even affects us, starting from childhood. So, these are preventive practices. What can we do? What can we inculcate in our society, in our children, so that they have certain kind of habits and lifestyle where they don't even get these conditions? That is first and foremost. The second one is, whatever we do, because of some environmental factors, genetic factors, and because of certain situations, people will still get these conditions. How can we detect them on time? If we detect them on time, the treatments will be started on time, and long term consequences, long term complications can be prevented. Because today, when we talk about diabetes or hypertension, it is not what is happening today we are worried about. Yes, we have diabetes, we'll take medicine, sugar is high, we take medicine. Nothing is happening to us today. In fact, it's a silent disease. We don't even experience symptoms many times. But why we are taking treatment, why we need to detect on time, is to avoid complications 2 decades later. If we don't treat diabetes today, down the road, 2 decades later, this will lead to blood vessel constrictions, blood vessel problems, which in turn lead to heart attacks, loss of vision, and ulcers on the feet or extremities that can even lead to amputation of limbs. Why? Because the blood vessels were affected. The very tubes that are carrying oxygen and blood to all our organs, when they are affected, we have problems with the organs, namely heart, eyes, kidneys, skin, all these things. Similarly, I'll take example of hypertension. Hypertension is called a silent killer disease. Why? Because you don't see symptoms. Yes, some people say I get headache, I get pounding in my head, and some people might experience chest pain. But many people, almost two-thirds of people, do not experience any symptoms. They only know because they went to the preventive health checkup and they checked and they came to know that blood pressure is high, above 140 by 90. That is the normal range, above 140 by 90. But if you ask them, do you have any symptoms? Most of the time, two-thirds of the time, they say, no, I don't have any symptoms. I didn't even know that my blood pressure was high, right? So today's whole talk is about detecting on time, preventing and detecting on time. And what do we tell these people? Most of the people in organizations, I'm sure in your organization too, are people that are below the age of 50. That means that they are in the beginning of the disease. They either probably are worried, they haven't yet gotten, their parents may be having, one of the parent, brother, sister may be having. So they want to know more about it, or they just recently got diagnosed by one of these conditions. So the all of you need to know how to manage these conditions. What are the basic principles that you need to understand? So We will talk more about that. Okay. Now, again, coming back to hypertension. So, you will not have any symptoms, but if it's not treated, if it is not brought under 140 by 90, in the long run, the same things happen, same as diabetes. The blood vessels get damaged. The blood vessels are very crucial. These are the ones that carry blood to heart, eyes, lungs, kidneys, and skin. So, kidney damage is one of the commonest complication for both diabetes and hypertension. Heart disease is the commonest complication. Heart attacks are commonest complication for both diabetes and hypertension. Hence, we need to detect. Hence, we need to practice all the preventive measures. And then, of course, we need to know how to manage the disease, because yes, we are diagnosed, yes, we have high blood pressure or high blood sugar or cholesterol issues. What do we need to do? What is it that we need to give up? And what are how do we manage these doctor's appointments and repeat lab tests and all that? So, three pillars: prevention, detection on time, and managing disease. That's what we'll talk today. Now, first, we'll talk about prevention. Now, for most of these, the fundamental thing is to have good intake. That is, your diet should be good. It should be full of antioxidants, fruits and vegetables, where you take lot of nutrients, namely minerals, vitamins, and good fats, but omit bad fats and saturated fats. So, what is it that you need to eat? Have make sure your plate has lot of vegetables, fruits, nuts, whole grain cereals. So when I say whole grain cereals, it is unpolished rice, it is unpolished wheat flour. These are the ones. And now millets are also very popular now. At the end of the day, whatever we are talking, we it is all centered around how to cut starches. We Indians have a habit of taking lot of starch, whether it is rice two times or wheat roti two times. That is our base, and then comes the vegetables as a side, right? So how to cut down on the quantity of these starches? We don't need to completely abstain from these. In fact, lately the recommendation by a lot of doctors and dietitians, um, including Ayurveda and all these advisors, is that never move away from your staple diet. What you have been eating, what your ancestors have been eating for generations. If they are eating rice, you don't need to completely cut down the rice. You just cut down on the portion, that's all. And replace maybe white rice with polished, unpolished rice. Similarly, roti made with unpolished atta, and cut down on the portion, and include lot of vegetable in your diet, and make sure you include probiotics. There is a lot of light being shed now that probiotics are very important to have a very healthy gut biome. These are, if your South Indian idli comes under that, any fermented food, dosa can come under that, dhokla comes under that, your raita, yogurt, all these things come under the fermented foods. Um, so when we are talking about millets or all these things, we are basically sticking to the basic principle of cutting down on the simple sugars and starches. Okay. Second one is, we have a habit of eating lot of starch and sugar and less
Dr.
protein.
Lavanya, I
Yes,
think
yes.
the slides are frozen again. We are on the slide,
Prevention part.
we are on 10th slide.
Prevention, right? Yeah,
Yes.
yeah, I'm talking about that only. I'm just
Okay.
elaborating on each of
Okay.
these points.
Okay, my
Okay.
bad. Sorry.
Huh. Yeah, sure.
So, Lavanya, does it mean we need to cut the fermented food? Like
No,
what?
no, no.
Can you
Fermented
repeat
food
the
is
last
good.
one?
No, it's good. It's good.
Good. Okay.
Yeah. It's good.
Okay.
The age old recipes that typically, you keep food away for 12 hours, gets fermented. Like best example is dokla or idli, fermented batter, right? They're all good. Unless personally, if your gut is not able to tolerate it, you have an issue. Overall principle is that they're all good. Okay, so general principles are: cut down on starch and carbohydrate, but do not completely omit it. Do not go to these, very strict diets of no rice, no roti kind of diet. No need to do that. But cut down on the sugars and starches, cut down on sweets, cut down on deep fried snacks, but take lot of fruits and vegetables, include nuts, include millets. These dietary habits go a long way. Later again, when I'm talking about vitamin C, I'm going to talk about vegetables and fruits that have a very good amount of vitamin C. And the same fruits and vegetables have also iron, lot of selenium, zinc, and other supplements also. We'll cover it then. Now I'll stick to the basic principles when we talk about dietary habits. Then physical activity. When it comes to physical activity, so basic motto is: today if you're doing nothing, start somewhere. If you're already doing some activity, increase the activity. So the ideal activity for each person may be different. If there is an athlete who is already doing 1 hour of activity every day of a week, maybe he doesn't need to increase so much. But if there is an overweight person who is just walking for 5-10 minutes, that person needs to increase his activity levels to at least 30 minutes of walk. And then once he gets used to that, again the person needs to take it to next level, 30 minutes plus another 15 minutes of vigorous activity. So it is always like a stepwise fashion. It is not like one size fits all of us have one exercise prescription. Always increase in increments. Whenever you start exercise, do it for maybe a month, then take it to next level. Again after 2 weeks, take it to next level. Never start physical activity abruptly, and always aim to take it to the next level in gradual increments. That's the general principle. But if you talk scientifically, the recommended daily activity is at least 30 minutes of moderate activity and 15 minutes of vigorous activity. Okay, when I say moderate activity, brisk walk comes under that. Light gardening comes under that. Climbing stairs, 1 or 2 flights comes under that. These are all moderate activities. When we talk about vigorous activities, heavy gardening or jogging, or running on a treadmill, or swimming, doing laps, not just learning, or taking one lap at a time, doing multiple laps. These all come under vigorous activities, including aerobics, zumba. All these come under vigorous activities. So aim for 30 minutes of moderate activity and 15 minutes of vigorous activity per day. You can take 1 or 2 days break in a week. Okay. Now, smoking, absolute absolute no, because smoking is a risk factor for cardiovascular disease, hypertension, and many more. Lung cancer and many cancers are known to be the result of smoking. So absolute no to smoking and abstinence from alcohol. Today, alcohol intake has increased in the society. Alcoholic liver disease has increased. So alcohol has so many other effects. Accidents while driving. There are so many other side effects of alcohol intake. Then managing stress. This itself is a big session, managing stress. But one thing we can just simply touch base upon is breathing exercises, deep breathing and winding down and having some me time in a week, spending some time alone and having some me time, winding down, slowing down, at least take a break, couple of hours in a week where you have do nothing time, where you do nothing, your list is not existing at that time. So at least that kind of unwinding, if people can practice, that is one very small initial way of managing stress and lowering stress. But there are so many other tools, so many things in yoga. There are a lot of good breathing exercises that can help manage stress, and this is just a start. Okay, so if a person can take these basic lifestyle changes, the initial measures for prevention have been started, you can say that. On top of that, yearly health checkups and all that will talk at early detection. Now today, all the employees are getting yearly health checkups. Make sure you don't miss it. Make sure you get the basic tests done. I have listed the basic tests that you need to get done yearly. Basic blood sugar check. It can be fasting blood sugar test, and HbA1c. These two are very important because diabetes doesn't have symptoms. If you get that yearly, your diabetes will be detected, or sometimes pre-diabetes will be detected, and there you can start taking some measures so that your pre-diabetes does not progress to diabetes. Another one is BP check. Again, hypertension is a silent disease. BP check and cutting down on salt. We call it DASH diet, dietary approaches to solving hypertension. Lots of fruits and vegetables and cutting down on salt has shown to improve blood pressures. Okay, cholesterol check. We check the bad, in that you get bad cholesterol, good cholesterol, triglycerides and all. So you have to lower the bad cholesterol, increase the good cholesterol. Exercise and diet are two good ways to doing that. If a person is overweight, the BMI is above the normal range, they can start working on losing few pounds. So every 3 or 4 kilos weight lost will lower your risk of blood pressure, blood sugar, and cholesterol, bad cholesterol. So if someone is 90 kilos, they don't need to come to their ideal body weight of 75. If they come from 90 to 85, there itself, their risk is going down for heart disease, diabetes, and hypertension. So that gives a lot of motivation. That's very positive thing. It doesn't have to be always ideal weight. There is always that 5 kilos. If you lose, you're in a better place. Again, lose another 3 or 4 kilos. So it can be in an incremental manner. So when you start, think that every kilo you are shedding, you are improving. Okay. And generally, the realistic goals are, unless you are extremely obese or extremely overweight, slight increase in BMI, you should not lose more than 2 to 3 kilos a month. General principle is that you need to let your skin settle down, let your, um, body get adjusted to your exercise, workout and diet and all that. That is why it's better to avoid fat diets and focus only on losing 2 to 3 kilos per month. If you consistently do that, it goes a long way. Now here I have listed pap smear. Pap smear is one test that can detect cervical cancer, which is a major cause of death in women, major cause of cancer deaths in women. So unfortunately, all the cancers don't have screening tests. Only few cancers have screening tests. So cervical cancer has a very good screening test. All women should get pap smear once in 3 years if they're above the age of 25, 26 years. Okay. So these are the tests. These are the basic tests. If you take a comprehensive exam, of course, you will get creatinine checked, you will get liver function checked, you'll get an ultrasound to see if you have a fatty liver, and You may get your electrolytes checked, you get your vitamin D, vitamin B12 checked. All those come under comprehensive exam, which is good. But these are the basic tests, these are must have tests. Those are good to have tests. Okay. Now, early detection, when we talk about early detection, going to the doctor on time when you have a suspicion, that goes a long way. A lot of people, they know that going to urination frequently is a sign of diabetes. Losing weight is a sign of diabetes. Frequent infections, whether it is urine infections or skin infections, is a sign of diabetes. Despite knowing that, somehow they postpone the doctor's appointments. Always seek help. If you are above the age of 30, it is always good to have a physician. If you don't have any issues, you can meet the physician, once in 2 years or once in 3 years. If you have a condition, meet them every year, but always have a physician. Never be in a situation where you don't have a physician. Because what happens is, if you don't have a physician, you don't have that one person who will put things in perspective for you. Okay. If you have headache, you're going to neurologist. If somebody is having cholesterol, they're going to cardiologist. If they're having a kidney stone, they're going to nephrologist. So this pattern of going to lot of specialists and not having a physician is taking toll on the society, where people are taking multiple medicines. Right hand doesn't know what left hand is doing. So a physician is one, MD general medicine doctor is one doctor who can review all your medicines, who can guide you in difficult situations. He may not treat all the complex conditions. So always have a physician. This goes a long way for non-communicable diseases. Okay. Next one is, okay, the prevention is done, detection is done. Now, how do you manage the disease? You have diabetes, you have thyroid, you have hypercholesterolemia. How do you manage the disease? The first and foremost is, the doctor might give you suggest you lifestyle changes in the beginning, because even doctors want to give some time for lifestyle. Because what if the person changes lifestyle a lot, that disease comes under control. Unless you're having very high numbers, doctors usually give 3 to 4 months time. But make sure you follow up with them, make sure you repeat the tests. What if the tests are not going down, in fact they're going up? You will never know if you don't repeat the tests. So never skip follow-ups. Always, if the doctor said repeat the test, please repeat the test. And again, once you are detected with the condition, again the doctor will discuss all the lifestyle changes that I talked to you about. Maybe a little bit more elaborate. Diabetes has certain more elaborate changes. Hypertension has some more elaborate changes. Kidney disease, they may tell you a little bit more elaborate changes. But consult a dietitian, or listen to your doctor if he himself is explaining, he or she is explaining. Okay. And learn about your disease, whether it is diabetes, hypertension, kidney disease, whatever it is. Okay. Now, at the end, for non communicable diseases, every day what we do, how we live, it impacts our risk for non communicable diseases. Keep moving. Sitting is next to smoking is the slogan now. Like, if you are sitting a lot, and many of us are sitting due to our jobs, but at least every 1 hour get up and stretch and move a bit. Okay. So keep moving, and make mindful choices when you're choosing food. Mindful eating. While you're eating, don't do anything else, focus only on eating. That will cause satiety earlier, you'll end up eating less, and your satisfaction level will be better because you're savoring your diet. And make sure you're exposed to sun. Make sure you have ample vitamin D in your body. More and more conditions, lifestyle conditions, like arthritis, um, and depression, obesity, lot of things are, a lot of light is being shed on the causative factor of vitamin D deficiency on these conditions. Why? Because we are spending indoors. Our body clocks are not in line with the circadian rhythm. So since ages, our body's clock um, is working along with the sun's rhythm. Like in the night, it slows down, digestion slows down, lot of organs slow down, and that's when you grow, you recuperate, your mind rests and all. When we are not in line with that, lot of conditions, non-communicable diseases are happening. Okay, so at the end of the day, meditation and cutting down on the gadgets, is it goes a long way to improve family relationships and social interactions, which in turn again indirectly help in being healthy and eating less, and decreases the risk of lot of conditions. Okay, now we'll briefly talk about vitamin C, importance of vitamin C, and then I'll take questions if you have any. Now, vitamin C is the star ever since COVID has happened. Everyone is talking about immunity and vitamin D and vitamin C. These two vitamins have gotten a lot of importance and a lot of attention in all the health talks and all. Now, honestly, all vitamins are important. Each vitamin has a certain role to play. Though, because of immunity boosting effects of vitamin C, we are talking today about vitamin C. A is very important, D is extremely important, B complex is very, very important, vitamin K is important for blood bleeding, clotting, and all that. So anyway, today we'll talk about vitamin C. It helps in wound healing. It boosts immune system. It causes the production of white blood cells. Good optimal action of white blood cells to kill the germs. Hence, boosts the immune system. It helps in growth of tissues, including cartilage, bones, and teeth. Vitamin C deficiency is there. You may experience loose teeth and teeth problems. Helps in iron absorption. Whenever you are taking certain green leafy vegetables, little bit tomato, or the vitamin C rich diet is added, ingredient is added, the absorption is much better. Iron will get absorbed better, and blood will be formed in a much better manner. So it prevents anemia. Good amount of iron and vitamin C intake prevent anemia. And vitamin C is an antioxidant. Because certain conditions are caused secondary to oxidative stress, if you take vitamin C, because it's an antioxidant, it decreases risk of cardiovascular disease indirectly, and certain other conditions. Okay, like autoimmune conditions, maybe you'll deal better with them. It promotes eye health also, macular degeneration and cataracts. It comparatively, you can postpone them just a bit. And it is also helpful in skin's health and elasticity, prevents wrinkles and spots on the skin. So these are the functions. There are many more functions, but these are the main functions of vitamin C. And what happens when vitamin C is deficient? Your wound doesn't heal. You may have bleeding gums. If you have any kind of scar or scratch, you may see that it doesn't dry up very fast. Iron doesn't get absorbed, hence you may get anemia. You will see a lot of fatigue because you don't have that boost of immune system. You may have teeth problems like loose teeth. All these are the vitamin C deficiency can cause a condition called scurvy, where you have bleeding gums and low healing and all that. Now, that said, how do we boost vitamin D? Yes, we can take supplements, but before we go to supplements of any vitamin, always think about natural diet. Citrus fruits, including oranges, lemons, all citrus fruits, they are very rich in vitamin C. Tomatoes are rich, bell peppers, broccoli, all kinds of berries, papaya, mango, kiwi, guava, pineapple, and sprouted grains have good vitamin C. Um, Anything that is a bit sour, that generally has vitamin C. Now, can we take supplements? Yes, supplements do not harm, while we should focus on dietary intake, natural foods that are rich in vitamin C, we can also rely on supplements. Few months, like 3 months of supplements, taking supplements and again giving a break may not be a bad idea, especially if you're thinking that you're getting frequent common colds, coughs, and all that. If you have any suspicion, you can take. And some people have a lot of acidity issues. They cannot take citrus fruits or anything sour. We see that commonly. Their gut doesn't just get along with lot of the citrus fruits. So these kind of people who cannot take lot of tomato or for any gut related issues, citrus fruits and tomatoes and these items, they can take supplements. Recommended daily intake is generally 90 milligrams for men and 75 to 90 in women. And over the counter chewable tablets that are tasty, we get lot of vitamin C supplements. The good thing about vitamin C is you cannot overdose yourself because it's a water soluble vitamin. If at all we take a little bit more, it just gets excreted in the urine. But that said, you should only take the recommended amount, 1 or 2 chewable tablets a day, not more than that. Um, and yeah, I mean, pregnant women, doctor may sometimes give vitamin C supplements. This can be a part of multivitamins also. The prenatal vitamins that doctors give, that may include vitamin C also in recommended daily doses. So this is a brief about vitamin C, which can help in reducing lot of respiratory infections and boost your immunity. I'll stop here and stop screen share, and please ask if you have any questions.
I see one on the chat, doctor. The rest can still take some time and type or unmute and ask directly. Does
Okay.
having cervical cancer vaccine after 35 help in preventing cervical cancer?
Okay, good question. Ideally, the cervical cancer vaccine should be given, as you know, because the very fact that you're asking this question is probably because you already have the knowledge when it should be taken. The ideal age is between the 9 years and up to 25 years also is okay, but 9 to 13 is the ideal age. Okay, so until 25, yes, there is lot of benefit, but after 25 the benefit gradually decreases. So a brief answer to your question is not to the full extent. To some extent there is benefit, because at the end of the day, HPV is an infection. The person already had some infection and then now they are taking vaccine. It is of limited use. Because of that, I say there is a limited benefit. I hope I didn't confuse you and answered your question. If there is any doubt, please ask again. So again, this other question is also very similar. Which vaccine should we take for cervical cancer? HPV vaccine. HPV vaccine has come into the market in the last 10 years. Last 5 years, it's available in India. But many women in India across the globe have missed the chance because it is best given between 9 and 13 years of age, and because many women have passed that age, they have missed the chance. But the recommendation is that until the age of 25 it is still very good. Until the age of 35 you can still consider with some limited benefit. Okay. um, No, there are not two types of vaccines. There is quadrivalent vaccine, nanovalent vaccine, like that. So each of there used to be trivalent vaccine. What these vaccines do is they cover different strains of HPV. For example, quadrivalent vaccine covers all four important HPV strains. Okay, it vaccinates, it provides prevention against all four important HPV strains. That's why it's called quadrivalent. Okay, nanovalent covers, provides immunity for all 9 HPV strains. Okay, quadrivalent is good enough. I think that's what you mean. It's not types of vaccine. The vaccine is one. They kept on over years, they keep on improvising it. First it used to be um, bivalent, then it became quadrivalent because they added two more uh, ingredients for two more viruses. Then they expanded to nanovalent. But today if you can take quadrivalent, you're in a good place. Okay. How to stop converting pre-diabetes into diabetes? So there are I mean this the answer depends on your age, your weight, and your family history. Suppose you are a person who is overweight. First and foremost, you focus on losing few pounds. How do you do that? By cutting down on calories and gradually increasing the activity. That is first and foremost. Second one is cutting down on simple sugars and fats, especially bad fats, that is saturated fats, and increasing polyunsaturated fatty acids, that is nuts. Ghee is good, but cut down on dalda, deep fried samosa kind of evening snacks, and cut down on sweets and bakery items. Increase if you have craving for dessert, maybe you want to take dates, or you may want to take something made of nuts instead of a laddu made of simple sugars. So always choose alternatives and move to food items that have low glycemic index. What do I mean by that? Anything that melts in your mouth, just stay away from it. Anything that melts in your mouth and tastes extremely sweet, stay away from it. Like what items come under that? Like simple sugar sweets, all those sweets, um, bakery items, white rice. These are the things. Anything that you have to chew to get the taste, stick to those items. Okay. So, to summarize the answer, lose weight if you are overweight, cut down on simple sugars, and get annual check done so that you take medicines when you need to. Okay. I have vitamin D that is 8. Can I take supplements or need to consult a physician? If your vitamin D is 8, immediately you need to stick to this regimen. Every day you need to have at least 30-40 minutes of sun exposure. Don't do it in the middle of the day, because now, because it is summer, you can get dehydration, heat stroke and all. But in the beginning of the day is better, 8 to 9, or evening 4:30 to 5:30 may be a good time. That is the first and foremost important. Yes, you have to take supplements because 8 is very low. You can consult a physician, they'll give you a prescription, take supplements, but supplements are only temporary. Long term thing is get exposed to sunlight so that you don't go into this cycle of deficiency again and again and again. Okay. Lack of energy on daily basis, very low the whole day. So there are so many causes for this. It could be vitamin D deficiencies, like we said today. It could be beginning of diabetes. It could be thyroid issue. It could be anemia. Lack of blood simply can cause, lack of energy and all. Generally, maybe you're not sleeping well. Maybe you're not resting well. A simply lack of sleep can give you, consecutively, if you don't sleep well for 3 days, in research says that it may take like 15 days for you to recuperate. So please check all these things. Do you snore at night? Inadequate oxygen because of snoring? All these things can cause tiredness. Consult a physician. They'll go in a methodical manner and maybe, if needed, order some tests, and don't ignore this fatigue issue. If you have any other question also, you can ask regarding this lack of energy issue, because I know I gave a very broad answer. If you need any pointed suggestion, you can ask. Yes, Gardasil is fine for HPV. PCOS and hyperthyroid conditions. Hyperthyroid, simply you need to take medicines, and they say goitrogenous vegetables like thyroid, cabbage and cauliflower, should not be taken, but you can take them in moderation. Nobody eats them a lot, so take in moderation. But other than that, for hyperthyroid, there is not much diet or lifestyle. You have to take medicine. Okay, now coming back to PCOS, there is a lot you can do. PCOS, first and foremost, is you have to exercise, physical exercise. Being physically very active is extremely helpful for PCOS, which indirectly helps in your weight loss. That again regularizes periods and all those things. So first and foremost, cut down on calories, start exercising. Extremely useful, these two. I've seen people in 6 months, because they made these changes, PCOS has gradually reversed. Any other vaccine available for other cancers? No. No other vaccine is available for any other cancer. Ideal HbA1c for a normal person, ideal is below 5.7. Okay, 5.7 to 6.5 is pre-diabetes. 6.5 and above is diabetes. So when you say ideal, it is below 5.7. Okay. So there, despite losing weight, you could not, if you could not reverse, then you may be very good candidate for some hormonal treatments. Continue following up with your endocrinologist. Okay, so two kinds of doctors manage PCOS. One is gynecologist, other one is endocrinologist. Either of them is fine. You lost weight, still you're having a PCOS, that means that you need hormonal treatment. Okay, that will really help you. This question about conception, I am not the right person to answer, because I'm not a specialist in that. Your gynecologist would be the right person. Okay. So to reverse hypothyroidism, generally it's only if it's in the very beginning. I have seen some people take very low dose, like 12.5 micrograms of Tyronorm, or Eltroxin, and then over time it got reversed because body's condition has changed. But once you're requiring 50 micrograms or above, it is very difficult to reverse the condition. Okay, very few people I saw that hypothyroidism has gotten better. So issue with weight gain, again, weight gain can happen for various reasons. One is you're taking more calories than you're burning. That's a simple cause for weight gain. For many of us, that is the cause. Simply, the intake is more than expenditure. But if you are sure that your intake is not more than expenditure and your calories have remained the same, but still you're gaining weight, then you need to consult a doctor so that you have certain tests done, especially thyroid check, so that um, the root cause can be found out. Okay. How can you prevent vitamin B12 deficiency? B12 is very common in vegetarians. Of course, lately B12 deficiency has become a very common issue. It is seen in lot of green leafy vegetables, liver and all that, chicken liver, and eggs are a good source. but for whatever reason people are not having enough of these and B12 deficiency is seen, you can take supplements. Supplements are not bad at all. If your vitamin B12 is very low, it may take a long time to correct. Start supplements right away. So if you want to gain weight, see why you want to gain weight. uh, are you below the ideal weight? Then it may be okay to gain weight. But if that is not the reason, I mean, just enjoy being light, right? I mean, still, if you want to gain weight, gain in a healthy way. One or two ways. In fact, a good way of gaining weight is exercise, muscle building exercises. That will give you strength. While you're gaining your weight, you're gaining your weight in the form of muscle, and you're increasing your strength. Your posture improves, your stamina improves, your muscle pulls, cramps, all these things don't happen because you're always in condition. So one good way to gain weight is start doing exercise and take diet that is rich in protein. Okay. So
Dr. Lavanya, is it possible to share the PPT? A lot of people
yeah,
have
sure,
questions.
sure, I can share the PPT.
Yes, sure. Thank you so much.
Welcome. I think we don't have any more questions.
Yeah.
So, multivitamin tablet name, people are asking. There are a lot of tablets on in the market. All are equally good. One is Bicosules, Revital is good, A to Z is good. Okay. Yeah. Thanks everyone for your attention and. Sleep problem is a big subject. What see if you're snoring, if your partner or family members are saying that in the night you snore a lot or you stop breathing in the middle, or when you get up you are not at all refreshed, you have headaches and all, that means you have a snoring problem. Okay. So for that, first of all, you check with your family members, do you snore? Is that the cause of your sleep problem? Other kinds of sleep disorders, insomnia has so many reasons, right? If you're stressed, you can't sleep. If you're exposed to gadgets just before being to sleep, you can't sleep. If you're thinking before you go to bed, then your sleep is not um, very uh,
I just want to ask some question regarding uh, when people wake up like at early 3 a.m.
uh-huh.
So according to Ayurvedic, like a person need to have breakfast within 4 hours of wake.
Okay. Huh.
Okay, so if what if person how to need to manage the sleep. So if he slept like a very late night and wake up at 3,
Mm-hmm.
that level of stress will build up, and how we need to like divide the sleep pattern accordingly.
See, if you slept late, then you don't need to get up at 3 a.m. Make sure you get good sleep, right? So, why do you need to get up at 3 a.m.?
So body is generally waking up with a natural sequence.
Okay. So, you're just getting up
So
without alarm, you're
someone has like mental stress and waking up at 2 o'clock or some
got
kind
it.
of a.
Yeah,
So
yeah, yeah.
then the sleep pattern is not completing. I am facing the same issue like disorder. So again, afternoon, if I had the lunch, I felt
Uh,
like a lot of sleepiness afternoon.
So, yeah, the underlying cause is overthinking and stress, right? You need to work on that first. Take a consult with a psychologist. They have some techniques, right? Before going to bed, there are certain breathing techniques, there is certain, meditation techniques. If you don't do any of those, you will wake up. Your sleep will never be completed, and you will go in this vicious cycle of afternoon sleepiness, insomnia at night, and again and again. right?
Same sequence repeating.
Yeah.
So how to manage
What
like
I'm
a
saying is, there are certain helpful techniques. Consult a psychologist. Okay, elaborate about your problem. They will guide you well. Okay.
so it's sleep deprivation is related like not having proper type of diet or something just
No, no,
only a
you
sleep
yourself are saying
disorders.
that, no, you yourself are saying that you're stressed, right? If you may be
Hmm.
thinking about something else, generally diet has some part of lack of sleep, but mostly it is the psychological issues, not able to wind down at night. Okay, so you need to. I mean, that's what I'm trying to tell you. You need to go to the nitty gritties. You
Hmm.
need somebody needs to sit with you and understand why it is happening, then guide you accordingly, not just say something at a superficial level. Okay, the psychologist consult
One
will
more thing.
be very
I
helpful.
personally feel like uh, I don't want food. I just need some charging, like sunlight are enough for me.
No, you're
I don't
mixing
eat.
a lot of things.
I eat
No, no,
very
no, no,
little.
no, no. I think you're mixing lot of things. You're
Uh,
mixing food with sleep and sunlight and all that. You need to have a good day schedule. Okay, I think you're mixing up lot of things. In an intention to be healthy, you may be doing some wrong habits. Okay, I want you to sit and discuss these issues and write down what your work is like and how you want your schedule to be. Get an okay. Nobody will dictate your schedule, but at least they'll examine it and say, okay, this looks reasonable, stick to it, and again reevaluate after 1 week. Okay.
oh, that's fine.
Okay. So I think we are way ahead of time, but I would take two more questions.
Okay.
Intermittent fasting, does it help in weight loss? Yes, it does help in weight loss, but in studies it is proven that initially you'll lose a lot of weight, it plateaus down, which is fine, right? I mean, initially you'll get that benefit for 6 months to 1 year. After that, it will just stay like that. You don't, what I mean is, suppose you're 90 kilos, it may help in losing the first 10 kilos. After some time, it may plateau out, but it certainly is helpful. But make sure when you're doing intermittent fasting, you're taking nutritious, nutrient rich diet so that you don't have other side effects. And make sure, I mean, if you have diabetes or anything like that, you need to discuss with the doctor before you go to that. Okay. Miss Lakshmi, I hope I answered the question. If you have any more question, you can quickly ask. Which diet helps in losing fat and not muscle? Okay, simple answer. Diet itself will not help in this. You have to exercise along with nutritious diet, because whatever you take, if you're not exercising, if you're sitting, you're having a desk job and you don't exercise, the carbohydrate also gets converted to fat. The muscle that you take, the protein you take also get converted to fat, because you don't use it, you lose it. So whatever diet you take, healthy diet rich in fruits, veggies and protein, but along with that, only if you exercise, your muscle will build up and you lose fat. That's the logic. Okay. The only way to build muscle and lose fat is exercise. Diet will only help you in shed weight, but you will be out of shape. Your muscle will still be very weak, very thin. Okay. So, Mr. Deepesh, I hope it's clear. If you have any confusion, you can ask. You can ask a question to clarify. If not, we'll close here. Pinkaksha, shall we close?
Yes, doctor. Thank you so much.